Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Pulmonary artery hypertension. So pulmonary artery hypertension, there is increased pressure. So increased pressure is seen in case of the vessel leads, and this leads to the enlargement. Next is there is the RDPA. RDPA is greater than 16. This is in case of the males, and if the RDPA it becomes greater than 15. This is in terms of the females. So there is a jug handle appearance which is very prominent. The central pulmonary artery, it may be prominent and it is known as a Fleischer. The Fleischner sign. The peripheral vessels, it goes into constriction and leads to the peripheral vascularity, and this is known as a prune tree appearance. Next is the back pressure. The back pressure will go into the right ventricle and this leads to the RVH. RVH is seen as a retrosternal obliteration. Retrosternal obliteration. Now this pulmonary artery and the ascending aorta, it becomes greater than 1. So it is greater than 1. This is a pulmonary artery as well as the ascending aorta. So this will signify the presence of the pulmonary HTN, that is a hypertension. To learn and grow daily like this, please do subscribe.